A woman calls an ambulance because she can't breathe. 7 minutes later, she arrives at the hospital. She gets oxygen, a few basic tests, and then she goes home. A week later, the bill arrives. Ambulance ride, $3,200. Emergency room, $5,700. One small bag of IV fluids, over $400. And she had insurance. Now imagine opening that envelope. Your chest tightens, your stomach drops. You read the numbers again and again because your brain refuses to believe it. How can getting help bankrupt someone? That's the question millions of Americans ask every year. And the scary part? This isn't rare. This is normal. Welcome to the American healthcare system, where people fear medical bills almost as much as illness itself. And what you're about to learn will completely change how you see healthcare in America. Think about how strange this really is. In most developed countries, people worry about getting sick. In America, people worry about the bill. People avoid ambulances, delay doctor visits, ignore symptoms, skip medications, not because they want to, but because they're scared of what it might cost. And honestly, that fear is rational, because medical debt is one of the leading causes of financial stress in America. Not luxury spending, not vacations, not designer clothes, medical bills. That means someone can do everything right, work hard, pay taxes, have insurance, and still end up drowning financially because they got sick. Now here's where the system becomes incredibly confusing. Most Americans don't actually know what healthcare costs before they receive it. Imagine going to a restaurant, ordering food, eating the meal, and only finding out the price weeks later. That would sound insane anywhere else, but in healthcare, that's normal. And that's only the beginning, because hidden behind every medical bill is a massive system almost nobody fully understands. Hospitals, insurance companies, pharmaceutical companies, billing departments, middlemen, negotiated prices, secret pricing systems, and every layer adds more cost. So today, we're pulling the curtain back. We're breaking down why medical bills in America are so unbelievably expensive and why millions of people feel trapped inside a system they can't escape. Let's start with hospitals, because this is where most people think the money goes. And honestly, hospitals do charge absurd amounts. But here's the crazy part. The prices you see on medical bills are often completely made up. Not random, but inflated, artificially inflated. There's a hidden pricing list inside hospitals called a chargemaster, and this thing is massive. Thousands of procedures, thousands of prices, sometimes wildly inflated beyond reality. One aspirin, maybe $20. One bandage, $50. One CT scan, thousands. Now you're probably wondering, how is that legal? Because hospitals don't expect most people to actually pay those prices. Insurance companies negotiate discounts behind the scenes, which means the real price depends on who's paying. And this creates one of the strangest systems in America. Two people can receive the exact same treatment in the exact same hospital on the exact same day and get completely different bills. That's not healthcare. That's financial roulette.
Now here's where things get worse. If you don't have insurance, you often pay more, not less, more. Because uninsured patients don't have negotiating power, so they get hit with the full inflated price, which means the people least able to afford care often receive the biggest bills. And most Americans never realize this until it happens to them. Now let's talk about ambulances, because this part sounds almost fictional. In many countries, ambulance rides are free or extremely cheap, but in America, one short ambulance trip can cost thousands. Why? Because ambulances are treated like out-of-network emergency services. And here's the terrifying part. During an emergency, you don't choose the ambulance company. You don't compare prices. You don't negotiate. You're trying to survive. Which means the system has total pricing power, and people know this. That's why some Americans literally call Uber during emergencies, not because it's safer, because it's cheaper. Think about how insane that is. People are financially calculating transportation while dealing with medical emergencies. And this is where healthcare stops feeling like healthcare and starts feeling like survival economics. Now let's talk about prescriptions, because this part makes people furious. Americans pay dramatically more for many medications than people in other countries, sometimes double, triple, even 10 times more. And one major reason? Pharmaceutical companies. Now, to be fair, developing drugs is expensive. Research costs money, testing costs money. But here's where things become controversial. Drug companies also spend billions on marketing, lobbying, advertising, and legal protections. Meanwhile, Americans watch medication commercials every single day. Ask your doctor if this drug is right for you. That's normal in America. But many countries don't even allow direct pharmaceutical advertising like this. Now here's another hidden issue: patent protection. When companies create new drugs, they receive exclusive rights for years, which means less competition, and less competition means higher prices. And then there are middlemen, pharmacy benefit managers, insurance negotiations, manufacturing pricing systems, rebates. Every layer adds complexity, and every layer wants profit, which means the final price grows and grows and grows. But the patient at the pharmacy counter, they don't see the system, they just see the number, and sometimes that number is devastating. Now let's talk about administrative costs, paperwork, billing systems, coding departments, insurance approvals, denials, appeals, phone calls. Entire armies of people exist just to manage the complexity of the American healthcare system, and all of that costs money. Hospitals hire huge billing departments, insurance companies hire huge claims departments, and both sides constantly fight over payments, which creates even more administrative costs. Now compare that to simpler healthcare systems around the world. Many countries have centralized systems, simpler billing, more transparent pricing, less bureaucracy. America? The system is fragmented, complicated, and expensive. And ultimately, patients pay for that complexity. Now let's compare America to other developed countries, because this is where things become shocking. America spends more on healthcare per person than almost any country on earth, but Americans are not necessarily healthier. So where does all the money go? Partly into pricing power. Other countries often negotiate prices nationally. America doesn't. Other countries limit pharmaceutical pricing more aggressively. America often doesn't. Other countries prioritize transparency. America frequently hides prices until after treatment. And because America relies heavily on private insurance, the system becomes profit-driven at multiple levels. Insurance companies want profit, hospitals want profit, drug companies want profit, middlemen want profit, and when every layer wants profit, costs explode. Now, this doesn't mean every foreign healthcare system is perfect. They all have trade-offs. But Americans often pay dramatically more for the same medications, the same procedures, and sometimes worse financial outcomes.
Now here's the emotional part nobody talks about enough. Healthcare fear changes behavior. People stay in jobs they hate for insurance. People avoid starting businesses because they fear losing coverage. People delay treatment, avoid therapy, ignore symptoms, and silently hope problems disappear. Not because they're irresponsible, because they're scared. Scared of debt, scared of surprise bills, scared of financial ruin. And honestly, That fear is understandable, because in America, getting sick can feel financially dangerous, and that changes how people live. Here's the truth. Healthcare in America is not expensive because doctors are evil or because hospitals are uniquely terrible. It's expensive because the system itself became unbelievably complex. Layers of pricing, layers of profit, layers of negotiation, layers of bureaucracy. And somewhere inside all that complexity, the patient became secondary. That's the uncomfortable reality. And until people understand how the system works, nothing changes, because confusion protects the system, transparency threatens it. So if this video opened your eyes, share it, because millions of Americans are struggling silently with medical debt and healthcare anxiety. And comment below, what's the craziest medical bill you've ever seen? Subscribe for more eye-opening financial and psychological breakdowns, because understanding the system is the first step toward protecting yourself from it.